Greetings and welcome to the third video in this series on dialectical thinking. In this video, we'll explore why our thinking is sometimes inaccurate in the first place. So let's get started. Okay, so if you remember, in the previous video, we talked about some of the assumptions of the original CBT, cognitive behavioral therapy. And original CBT was very helpful in helping us develop this idea of problematic thoughts. In other words, thought patterns that aren't necessarily very accurate or helpful. And that was a very revolutionary contribution to the field of psychotherapy, for sure. Why do we have thinking errors, or why is our thinking sometimes just off? Well, the reason for that is called a negativity bias. So what does that mean? Well, it means a couple things. One thing that it means is that we tend to favor false alarms over no alarms. So what does that mean? Well, let's assume you're walking through the woods and you see a stick, but you think it's a snake. That would be an example of a false alarm. You see the stick, but you think it's a snake, so what do? You have some anxiety, you have some panic, you react very strongly, but you will live. It was just a false alarm. But now let's assume you're walking through the woods and this time you see a snake, but now you think it's a stick. In that case, no alarm at all. You will have no anxiety and you might also die. So do you see how the negativity bias is adaptive to our survival? Once again, this idea of favoring false alarms over no alarms at all. If we didn't have any alarm at all, we would be at risk of extinction. Okay, so another way that we have this negativity bias is that we tend to learn negative events very quickly and very permanently. So bad situations only need to happen once and they just stick in our brains. Once again, this is highly adaptive to our survival because we might not have another chance to learn that lesson, right? So if something really bad happens, you better learn it the first time and you better learn it quickly and you better learn it permanently. But do you also see how this can cause problems? So the problem is the brain doesn't only learn negative events very quickly and permanently, but it also, shall we say, overlearns it. And that's why we have things like, very vivid memories or nightmares or flashbacks, sometimes years or decades later after the incident. So once again, while the negativity bias results in more negative emotions such as anxiety, depression, and anger, is adaptive for our survival as a species. But as we've also just established, it also accounts for many of the symptoms of PTSD and trauma that we've talked about in previous videos. The negativity bias also results in automatic negative thoughts, or as I like to abbreviate it, ants. People who have been traumatized tend to have a few ants in particular. So something that's very typical in people who have been traumatized is what I call the 3 Ps: personal, pervasive, and permanent. So, for example, let's assume you were violently raped. Well, that was personal, right? It happened to you. It happened to your body. But it was also pervasive. Why? Because it didn't just affect your body. It also affected your mind, your thoughts, your emotions, your behaviors, your reactions, your relationships, your work, your schooling, your ability to concentrate, right? It affected just about everything in your life. It was pervasive. And it was also permanent in the sense that it can't be undone. You can't be unraped. So the problem with trauma is once a trauma has occurred, now everything starts to seem personal and pervasive and permanent, even if it really wasn't, or even if it's really not. Another common automatic negative thought that you tend to see in people who have been traumatized is the hindsight bias. In other words, that's when you beat yourself up with everything that you should have done differently to prevent or avoid the trauma. The hindsight bias is basically shoulding applied to the past. And that particular day, the day of the trauma, this is what I should have done or should not have done. You could also think of the hindsight bias as sort of like fortune telling applied to the past. They should have known ahead of time what to do or what not to do. And of course, that's a thinking error. And another very typical ant that you will notice in clients who have been traumatized is an inordinate high degree of self-blame. And there's many psychological explanations for that, which we won't go into here, but just realize that is a very classic example of an automatic thought that you will probably notice in someone who has experienced trauma. So there are 3 really quick questions that you can use to help identify a potential ant, to help a client figure out if a particular thought or belief that they have might be an automatic negative thought. This is just a quick screen. One question is it logical? Right? In other words, is it even theoretically possible? Another question is there evidence? And a third question is, does it matter? And the reason you want to ask all 3 questions is because sometimes something is logical, right? It's theoretically possible that it could have occurred or it might be occurring, but there's absolutely no evidence for it. Or sometimes something is logical and there is evidence for it, but it doesn't really matter that much in the long run. So you can, once again, use those 3 questions as kind of a quick screen to maybe identify or flag a potential ant. Let's summarize some of the key points we have covered in this video. Point number 1. Most of us tend to have a negativity bias in which we favor false alarms over no alarms and overlearn negative events very quickly and permanently. While the negativity bias results in more negative emotions such as anxiety, depression, and anger, in the end, it is adaptive for our survival as a species. In particular, the negativity bias accounts for many PTSD symptoms. And point number 2, the negativity bias also results in automatic negative thoughts, which can be abbreviated as ants. People who have been traumatized tend to have the following ants in particular. The 3 Ps, personal, pervasive, permanent, in addition to the hindsight bias and self-blame. 3 quick questions to help identify a potential ant are, is it logical? Is there evidence? And does it matter?